I'm Erin, and I'm going to be doing the indwelling catheter video right now. So first of all, I would be getting my paper chart. My patient is Anna Pawlowski, so I'm checking her allergies and her date of birth, and then I'm going to enter the room, sanitize my hands. Hi Anna, my name is Erin. I'm going to be your nurse today. Can I get your name and date of birth? She tells me her name and date of birth, and I'm checking her two identifiers on her arm, and they both match, or her name and date of birth matches. Do you have any allergies, Anna? Yes, she does. It's to penicillin. What happens when you have a reaction? She gets hives. I'm also checking that identifier on her arm, and that matches as well. So she has an order for a indwelling catheter today. So Anna, today I'm going to be inserting a catheter into you. Have you ever gotten a catheter before? No? Okay. So you don't have any history of urethral strictures? Okay, great. So I am going to check for safety around the room. There's no clutter or anything like that. I'm raising the bed to a workable position for me and lowering the side rail. Are you comfortable, Anna? Do you need to use the restroom or anything before we get started? Well, you don't need to use the restroom because we're about to do a catheter. That's okay. So now I'm providing privacy, so drawing the curtain, and I am going to gather all of my equipment. So I have, actually not everything. I have my catheter kit here, some tape, which I'm just going to put over here, hand sanitizer, extra sterile gloves, and regular gloves. So I'm going to do hand hygiene again. All right, so Anna, I am going to expose your perineum now. So if you could relax your thighs for me so I can position her legs. Okay, and she's exposed now. All right, so I'm going to put on my gloves, and I would be doing peri-care now. And I'm going to, so I would be doing all of my peri-care right now. I'm checking to see where her meatus is, and I found that. So now I'm going to take off my gloves. Okay. And now I'm going to open up my catheter kit. So okay. So first of all, we're gonna grab the sterile field here. So, got that. I'm gonna put it here. And then I'm going to grab my sterile gloves. Great. Okay, so hands are a little sweaty. Okay. Okay. So my hands are now sterile. So I can go ahead and fix this sterile field so it's under her. And now I'm going to take this and put that over her like that. Okay. All right. So actually just gonna kind of boop that out of the way. All right. So now I can touch all my sterile equipment. I'm gonna put that there. So now I'm going to take out my hydrogen peroxide and pour that over my cotton balls. And I put that in the trash. Now I'm going to put my lube in the kit again. Trash that. Okay. Now I'm going to take my catheter out and keep it in the sterile area. So I'm going to pull this off. Okay, so now the first like 6 inches or so I'm going to put inside the lube. So that's in there now. Okay, and now I'm going to attach my syringe. Oops. Oh, oops. Take that off. So, attach that into the port. Okay. That would have been stayed there in the lube. Okay. So now I'm going to we'll spread her labia here. And now we're going to clean from top to bottom, starting on the farthest edge. Throw that in the trash. Now the closest to me. And right down the middle. Okay. So now I'm going to grab my catheter here, about 3 to 4 inches, and bring it over here. Okay, so now I'm going to ask her to bear down, please, and insert that 3 to 4 inches in. And then once I see urine, put it again about another 2 inches. Okay, and now I'm going to hold that in place and inject the saline, which is 10 milliliters, slowly. Okay, so now I'm going to take that off, and I'm going to pull, but there's some resistance there, so the balloon is inflated. And now I'm going to get some tape and secure this in place, leaving a little slack, and then I'll just tape that to her thigh. Okay. And now that the urine is flowing, I can take the bag and put that down under the bed level and attach to the bed. And now I'm going to clean up my area. So just put on my stuff. Okay. So now, well, I'm just gonna go to clean this up and all that. I'm gonna return her to a comfortable position. So return her legs comfortably, and I'll take my gloves off now at this point and throw those in the trash. And then put the blanket back over her. At this point, I would have, if I had to do any additional peri-care, I would have done that. I'm going to document that the amount of urine that I got, the color, the clarity of the urine, the size of the catheter, which was a 14 French, and the amount of water that was in the balloon. So I would have documented all of that, asked that she's comfortable, ensure safety again, so put the bed at the lowest position, put the side rail back up, make sure there's no clutter, call bell is in sight, and then I would go ahead and open back up the curtain and just make sure that the tube doesn't have any coils or anything like that, and everything looks good. And then I would just sanitize my hands again, and that is it. Thank you.